Welcome to part 4 of the Heart Failure Academy series. In this section, we will talk about medications, advanced treatments, and advanced care planning. First, we will talk about medications and heart failure. So medications. It is important to know your medications and why you are taking them. We recommend keeping a current list with you at all times. About 75% of Americans do not take their medications as prescribed, whether that's due to user error, provider error, maybe there was an error at the pharmacy, or peer pressure, or also pressure from the TV. Not taking your medications as prescribed causes 125,000 deaths a year, and it also accounts for 10% of all hospital readmissions. So some how-to tips for medications. Again, keep a current medication list with you at all times. Include the medication name, the dose, how often you take it, and why you take it. If you're unsure why you are taking a medication, ask your provider. We recommend using one pharmacy and getting to know your pharmacist. There are some pharmacies out there that will pill pack your medications for you. It is helpful to get organized, keep all your current medications in one place and in their original containers so you know for sure what medication it is. Maybe use a pill box that has the days of the week spelled out for you. Or you could also color code your pill bottles. For example, a red dot on this bottle means I take it in the morning, or if I take it in the evening, I'm going to put a blue dot on it. If it's a medication that you take twice a day, morning and evening, then you would put a red dot and a blue dot on that bottle. Maybe set up some kind of reminder system for yourself so you remember to take your medication. You can coordinate taking the medication with your daily activities, or maybe you can set an alarm reminder on your phone or on your watch. Whatever will best help you remember to take your medication so you don't miss any doses. Next, we will talk about medication assistance, because we don't ever want you to stop taking your medications because you can't afford them. Whatever the reason may be, if you can't afford your medication, contact your doctor. Let them know what's going on. They might know of some assistance program available that we could apply for, or they might be able to switch you to a different medication that would be more cost effective for you. You could also talk to your pharmacist. They might know of some coupons that are out there, or maybe have an idea of an alternative medication you could try, as well as asking for generics. Generally, they are going to be cheaper than the brand names, because one of the fastest ways to end up in the hospital is to stop taking your medications without discussing it with your provider. So whatever the reason may be, always talk with your doctor before you stop a medication. On the right-hand side of the slide are some assistant resources that are out there to help you. So why do you need medications for heart failure? Well, they help people live longer and feel better. They help slow down the progression of the disease. And they also reduce the need for emergency room visits and hospitalizations. So these live longer medications. These are the medications proven effective to help with systolic heart failure. No studies have shown that these medications specifically help with diastolic heart failure, but they are used to help manage risk factors. And this is not an all-inclusive list. These are just some examples. And you may be on a medication from each one of these 3 categories: the beta blockers, the ACE inhibitors, ARBs or ARNIs, and the aldosterone antagonists. All of these are proven guideline-directed medical therapy for heart failure, but each person responds differently to medications, so you may also be on one of these that is not listed on this list here. In the category aldosterone antagonist, those medications also have a diuretic component to them as well. So what are the good things that these live longer medications are doing for you? They help your heart pump more efficiently, which lowers your heart rate and your blood pressure. They help promote positive remodeling of the heart muscle, which may help improve your ejection fraction. They decrease or delay further negative remodeling of the heart muscle. They reduce the amount of oxygen and energy your heart needs to work. They decrease blood pressure, which decreases the pressure your heart pumps against. And they lessen the harmful effects of many hormones and substances your body produces secondary to your heart failure. Possible side effects of live longer medications. All of the medications can potentially cause positional dizziness and lightheadedness. So take caution when you're changing positions. Get up slowly. Take your time. All of them may cause fatigue, though this usually improves within 4 weeks of consistent use of the medication. Specific to the ACE inhibitors, you may develop a dry cough. That's been recorded in less than 10% of the patients who are on one. If you are one of those who do develop a cough which is bothersome, contact your provider and we can get you switched to an ARB. For spironolactone, this may cause gynecomastia, which is the enlargement of breast tissue in males. If you experience this, contact your provider and we can switch you to another medication like Inspira. And then for men, the thiazide diuretics or spironolactone may contribute to erectile dysfunction. And as we talked about before, always talk with your provider before stopping any medication. Some side effects warrant a change in the medication, but some are not actually side effects of the medication itself, but are an adverse reaction due to another condition or medication you are taking. Your provider will help work it out with you. Next, we will talk about Feel Better medications. These are used for both systolic and diastolic heart failure, often referred to as water pills or diuretics. They are listed here. And again, this is not an all-inclusive list. These are just some of the ones. But they help get rid of extra water and sodium, which helps prevent swelling and symptoms of heart failure. They decrease the shortness of breath you may experience with activity. When you first start on them, you will have increased urination because we need to get off all that extra fluid. But then as your fluid levels stabilize, you may notice less urinary frequency during the day as well as less during the night. Next, we'll talk a little bit about over-the-counter medications. If you need to take something for pain, Tylenol is what is recommended, and that's safest when used at 3 grams or less a day. If Tylenol is not working for you, discuss with your provider and they will help come up with a better solution. What we want to avoid is the NSAIDs or non-steroidal anti-inflammatory drugs, because these can contribute to fluid retention, kidney dysfunction, and high blood pressure. We recommend not using these at all or very sparingly on rare occasions. 'Tis the season for cold, flu, and congestion. So these decongestants are ones that are okay to use. Just note the bottom line here on the right. We want to avoid anything with the D, or pseudoephedrine or phenylephrine. But you'll note right above it, it says Mucinex DM. Anything with the DM is okay to use, but if that were to say Mucinex D, you would want to avoid. And the reason we want you to avoid some of these decongestants is because they have the potential to increase blood pressure and heart rate, and they may interact with some of the medications for heart disease. Let's recap medications. Do you need medications to treat your heart failure? Yes, absolutely. When I start to feel better, can I stop taking my heart failure medications? No. Even if your symptoms improve, you will still need to be on these medications. Should I skip my water pill when I have plans or am on vacation? We never want you to skip your water pill, but you may take it at a different time. For example, if you normally take it in the morning, but on a certain day, if you have an appointment you need to be at in the morning, it's okay to wait until you get home later to take it. And when you're going to be on vacation, it's best to reach out to your provider and they will help you come up with a plan. Do you know why you take these medications you have been prescribed? If not, ask your provider. Next, we will talk about advanced treatments and care planning. So some of the advanced treatments and options that are out there. First is valve surgery, if your heart failure is due to one of your valves. We also have a CardioMEMS device, which is a device to help your provider monitor and treat your heart failure symptoms. It's not actually a treatment, just a useful monitoring device. We have a LifeVest, which is an external defibrillator, and that's if your ejection fraction is low enough or it puts you at risk for developing a lethal heart rhythm. Generally, if you're on a LifeVest, your provider will put you on guideline-directed medical therapy and then recheck your ejection fraction by doing another echocardiogram about 3 months after being on guideline-directed medical therapy. And then if your ejection fraction improves enough, you will no longer need the LifeVest. If it doesn't improve, then we may need to go to a pacemaker defibrillator, which will then just be an internal defibrillator should you still be at risk for those lethal heart rhythms. Another option is a continuous IV medication to help with your heart failure. There is also a left ventricular assist device, or LVAD it's often referred to. And that is what the picture is to the right of the slide. It kind of looks like little plumbing work in there by your heart. And basically it bypasses the squeezing part of your heart, so it's doing the work of pumping the blood for you. And then lastly, we have a heart transplant. And both the LVAD and heart transplant are for end stage or near end stage heart failure. Next, we will move on to advanced care planning. So what is advanced care planning? Why is it important? Well, it is making plans now for the care that you want in the future. Getting things like a living will, power of attorney for healthcare, and really it's just a simple conversation that involves learning about your illness and understanding your choices, setting realistic health goals and a plan to achieve them. It's a discussion about your wishes should your health worsen, involving the choices about hospitalization and continuing or discontinuing treatment. And these are important to have in place in cases of emergency. None of us know when our time will be, so it's nice to have these already in place when the time comes. So what we want you to do is plan now. Make your wishes legal. And then we recommend revisiting these decisions routinely and after life changes. Just remember the 5 Ds every decade. Whenever there's a death or divorce, if you ever have a new diagnosis or any decline in your current diagnosis. There are resources out there to help you. April 16th is National Healthcare Decisions Day. And there is also palliative medicine. What we don't want you to do is ignore the inevitable. Do not assume that your family knows, because unless you've had this discussion with them, they're not going to know what you would like done. They can guess, but then they will be second guessing themselves on whether this is really what you would have wanted. And don't choose somebody who's not going to follow your wishes. So if you don't have a POA established, who is going to make these decisions for you? Well, first they go to your spouse, then your children, then your parents, then your siblings, and lastly, it gets appointed by the court. And they, of course, are not going to know what you would like done. Next, we'll talk a little bit about palliative versus hospice. Palliative care is specialized medical care for people living with a serious illness. The care is focused on providing relief from the symptoms and stress of the illness. The goal is to improve quality of life for both patient and family. And palliative care can occur at any stage of a patient's illness and can be delivered along with aggressive medical treatments. Should the illness progress, palliative care can play a larger role in caring for the patient. They will work with the patient's physicians to actively manage pain or other symptoms while addressing goals of care. Then hospice is compassionate end-of-life care for those who have a life expectancy of 6 months or less. A patient receiving palliative care for an advanced chronic illness may choose to transition to hospice. Let's recap advanced care planning. When should you start talking about your healthcare wishes? Now, if you haven't already. How old should you be before you think about advanced care planning? When you reach the legal age. Who should you choose as your power of attorney? Whoever is going to follow your wishes. And if I had these documents drawn up 20 years ago, I don't need to worry about it anymore, right? Wrong. Every decade you should review these documents and make sure they're still up to date with what your wishes currently are. This ends part 4 of the Heart Failure Academy series.